Okay, so welcome everyone. Welcome to Wellness Wednesday. Mother Kabambi has already prayed, so we go into the presentation. Last week, we started this presentation, and so because it's a long presentation, we will do it in 2 parts or even 3 parts if it's not finished today. So last week we were discussing men's health. For those of you who are here for the first time, we welcome you and we welcome our regular attendees, our regular participants. Thank you for coming again. In John 10:10, Jesus said, "The thief cometh not but to steal and to kill and to destroy. I am come that you may have life and you may have it more abundantly." So it's on men's health and it's on the prostate. This presentation is for education purposes and is not meant to be replace the advice of your medical professional. It is not to be construed as diagnosis, prescription, or treatment of disease. God is responsible for the results of obedience of his lifestyle plan. The receiver or user of this information must assume all risk personally for the use or misuse of these information. Therefore, this disclaimer serves as advice to the receiver that he or she is free to seek medical attention, advice, treatment, and diagnosis from a licensed medical personnel. So here is the photograph of the prostate, okay? So we have up here, number 5, the bladder. So this is the male reproductive system, sorry. So it's made up of all these different parts. It's made up of the bladder, which is here, and then there's a tube running down from the bladder all the way down through the penis, okay? That tube is called the urethra. You can see here, there is the prostate right here. Don't know if you can see my arrow. Where number 7 is, that's where the prostate is. And there's another tube running from the right-hand side of my screen, which may be your left. That is the seminal vesicle. And this is where the sperm is made. So the sperm is here, and the sperm, during ejaculation, the sperm will go through the same urethra tube. So the urethra tube serves for the bladder and also for the semen. Behind here, it's the rectum, okay, the male rectum, and below the penis here, it's the scrotum or the scrotum, which is the bag that holds the testicle, okay? Below the rectum, that's the anus, and that's, we all know that's where your feces come from. Okay, so we also discuss about the different type of prostate problems men could have, different type of prostate disease, one which is the prostatitis, which is inflammation of the prostate, when the prostate is inflamed and it's swollen. And then we talk about the enlarged prostate as well. Today we're talking about prostate cancer. So on the screen, you can see the normal prostate here, and you can see where the urethra is, it's a bit wide open. So the urine from the bladder could flow freely, okay? Next to it, that's a picture of the prostate cancer. You can see where the tumor is here on the prostate, and you can see that the urethra now is more narrower. So the tumor is pressing against the urethra, which prevents the urine from flowing out equally and, properly. So the human body is made up of cells that are divided, that divides and reproduce throughout the body. When newly created cells are defective and multiply, they create more and more abnormal and malignant cells, and these are called cancer cells. Prostate cancer is the most common cancer in men. So there was a study from about cancer from the World Cancer Report in 2014, and they did a large over a million cases, and they did over a million cases of diagnosed people, men who are diagnosed with prostate cancer. So the prostate cancer is slowly progressive. So it doesn't, it gives them signs. So it doesn't project, it doesn't just come rapidly, and you are diagnosed with cancer. So it takes time, but men have to be able to acknowledge the symptoms. All prostate cancers don't have the same degree of severity. 80% are discovered at an early localized stage. And so they come in stages as well. The disease progression is usually slow, as I said before. Prostate cancer is generally not associated with any specific symptoms. It can be detected during a recommended screening or during an enlarged prostate follow-up. So if you just go to your urology, or your doctor refer you to a urology, or you just take your opinion yourself, your husband or the male in your life, in your family, take interest in their health and said, let's go for a screening. This can be detected early at that screening. And also, if you're already suffering from enlarged prostate and you're on treatment and you go back to your urology for a checkup, they can monitor as well and pick this up early. Prostate cancer screening includes several examinations, such as a PSA blood test. And so these days we have PSA blood tests, like when you check your blood sugar, like glucose blood tests. So you can just prick the finger and take a little bit of blood, just like you do your diabetic check, your glucose check, and you can see the results. Also, you can go to your urology and they can take bloods as well and send it to the lab to get the PSA reading. Another way is a digital rectal examination and prostate biopsy. So the examination is when they put the finger up into the rectum, and let me show you a picture, to examine the prostate, because the prostate is like at the back side as well, between the anus and the testicles. The urologist would have to put their finger up to check and to feel the prostate. So here is a picture of that examination, digital retina examination. And because of this, some men, they have the concept of nobody should put their hand up in their bottom. It's like a taboo, especially for our Black male. And that's why so many Black male are dying from prostate cancer, because they don't want to be examined that way, and they leave it for too late. But even if you're examined that way and you're also examined with the PSA blood test, it's not conclusive. So the only thing that would be a true, give you a true reading, it's a biopsy. So the urology would have to take a biopsy, a specimen from the prostate, and send that off to the lab, and that would be the conclusive result. Sometimes your PSA would be raised, but that doesn't mean you have prostate cancer. That could mean that there's an infection of the prostate. It could also mean if the man go for the PSA test and he had sexual intercourse or any kind of ejaculation 3 days before, that could give a false reading as well. So once the urology, the tests come back, the biopsy test, and it says that you have cancer, your urologist would discuss the treatment strategy for you. So risk factors of prostate cancer: men above 50 years, well, it's from 40 years and up. If it's in your family already, if it's hereditary, then you go for testing at 40 years. So you can get the cancer at 40 years, or it would be 50 years if you don't have that cancer in your family, if it's not hereditary. It is in Black and Hispanic male, they are the most high ones with prostate cancer. A fatty diet in animal products, cheese, butter, and oil, that can also contribute, and milk as well, that can also contribute to prostate cancer. Reoccurring urinary or bladder or prostate infection, increased testosterone levels, lifestyle, if you are overweight, if you don't exercise, if your job is like sitting down all the time, you are in danger of at risk of having prostate cancer as well. Especially people like who do driving as a job, drive the buses, drive the taxis, any kind of driving job, long haul driving, this is one risk as well for prostate cancer. You must get up and walk sometimes, to think, to help as well. If you're lying down in bed very often as well, that could also be a risk factor for prostate cancer also. Some of the symptoms are the male are unable to hold their urine. If they go to, they go out for a function or they go shopping or wherever they go, the first thing they would look for is a toilet where they can urinate. Sometimes they would have dribbling. So if you're walking down the road or you glance at a male, the front part of his trousers, you'll see that it's wet. That's dribbling. After they finish urinating, they would still be dribble, a little bit come out. That's because the urethra is so close, the space is now reduced because the prostate is pressing against the urethra, so the urine is unable to come out. And sometimes they're hesitant as well. They have to force themselves. They go to the toilet, but they're standing over the toilet seat. They're hesitant to urinate because the urination is not coming out fluently. And they are weak and low stream urine. It's not powerful like when they were younger. And so they doesn't empty their bladder completely. And this stagnant urine in the bladder could also cause bladder infection. So most symptoms would be nocturia, meaning they're getting up very often at night to go to the toilet, and this is disturbing their sleep. And this would can also affect them during the day. It can, if you don't sleep well, it could increase your blood pressure and other problems. It could make you fatigue as well because you're not sleeping well. Burning sensation when urinating, blood in the urine, lower back pain, decrease in ejaculation, and painful ejaculation as well, of painful sexual intercourse. So here again is the photograph where the urologist would examine the prostate. So he'd put the finger in the anus and press against the prostate. So there you could see this little red knot here. That's the prostate. So he will feel that to see if it's inflamed, to figure out the size of the prostate, because prostate come in different sizes as well. The older you get, the larger it would be. Before you become a young male, before, they said before you break your voice, you know, you have no prostate until that time, then your prostate start growing, the sac start growing. And then that's why we have to speak to our young boys, they can get, that's puberty. They can get people pregnant at that age because they start making semen as well. So I've discussed these tests for the prostate, the prostagen test, the PSA test, the blood test, the finger test as well, and the biopsy test. What does the abnormal results mean? A high PSA level has been linked to an increased chance of having prostate cancer. It doesn't say you have prostate cancer when the PSA is high, but it's a chance, it's an increased chance, okay? That along with the other tests would determine if it's cancer. PSA testing is an important tool for detecting prostate cancer, but it's not foolproof. Other conditions can cause a rise in PSA include a large prostate, prostate infection, urinary tract infection, recent test on your bladder, or prostate biopsy. If you have a catheter in as well, catheter tube recently placed into the bladder to drain the urine, recent intercourse or ejaculation, and recent colonoscopy. That's why I said, if you're going for a PSA test, you wait, you don't have sexual intercourse for about 3 days before the PSA test. Otherwise, it would be a false reading. Your urologist will consider the following things when deciding on the next step. Your age, if you had a PSA test in the past, and how much and how fast your PSA level has changed. If the prostate lump was found during your examination, other symptoms you may have as well, like the urine symptoms. Other risk factors for prostate cancer, such as ethnicity and family history. So, it's very high in Hispanic and Black male. And if you had it in your family as well before, hereditary. What more abnormal results mean? Men at high risk may need to have more tests. These may include repeat of the PSA test more often in 3 months. So they would repeat the PSA test in 3 months. You may receive treatment for a prostate infection. That would be the first line treatment. A biopsy, prostate biopsy, if the PSA level persistently high. So if you go back in 3 months and the PSA result is still high, the urology would do a biopsy. An MRI on the prostate may help to identify cancer in an area of the prostate that is hard to reach during the biopsy. If you have been tested for prostate cancer, the PSA level can show if treatment is working or if the cancer has come back. So if you already been treated for cancer, you would have regular PSA tests. And so the urologist would take note of your readings. So if they keep rising, they would have to do other tests as well to see if the cancer has come back. Often PSA levels rises because there are many symptoms. Often PSA level rises before there are any symptoms, okay? So these are the tests. Again, they can do a PET scan for the prostate cancer. They can do a transrectal ultrasound of the prostate biopsy, a CT scan of the prostate as well. They can do X-ray of the prostate, and they can also do a gram stain culture of your urine. Conventional treatment of prostate cancer would be surgery. That would be the first line. And if the surgery don't work, or sometimes they combine, it would be combined treatment, which would involve surgery and radiotherapy. So it would be surgery, radiotherapy, or both, and hormonal therapy. They could also give you drugs for osteoporosis, which strengthen the bones, because when you're taking this therapy for cancer, it can weaken the bones. So they would give you drugs for strengthening the bones as well as a side, that would be as a side effect from the treatments, the therapies that you had. Natural treatment and prevention for prostate health. Beta-sitosterol, which is a plant-based compound with a wide range of anti-inflammatory effects, especially on the prostate. This neutralizes free radicals, which contribute to prostate enlargement, okay? And the beta-sitosterol improves the urine flow through the urethra and promotes more complete bladder emptying. So it kind of widens the urethra, so the urine could flow easily. Salpomellos, which a lot of us know is associated with the prostate, treatment for the prostate, and this have a lot of beta-sitosterol in it, as well as other plant sterols. And it's a very powerful antioxidant as well. It have lots of antioxidant properties in salpomellos. Salpomellos is like it's like a palm tree, and the beads, the fruits from it, the berries from it, that's what they use for the treatment, salpomellos. And you can get salpomellos, capsule and stuff in health shop, Allen and Barrett and other health shops. While beta-sitosterol is the most potent, the entire complete complex of the plant sterols contained within salpomellos work together to provide comprehensive support for an enlarged prostate to release to help with the bladder as well, frequent urination. Stinging nettle, our famous stinging nettle as well, is good for the prostate health. The stinging nettle leaves, the roots, and the seeds as well. They works like salpomellos as well, and they are very high in anti-inflammatory. As we know, the stinging nettle leaves as well is good for high blood pressure. And so the leaf, the whole of the plant is good for prostate health. Lycopene, we find lycopene in tomatoes, and lycopene give the reddish color to the tomatoes, and it's high in anti-inflammatory, and it also helps with the prostate, but avoid the seeds. So men must avoid the tomato seed, but the tomato is very good, very high in antioxidant, and helps with your prostate health. Pumpkin seeds, they are rich in plant sterols and carotenoids. So these two together, the plant steroids and the carotenoids, they are like an antioxidant package. So you will find both in the pumpkin seed. So, you know, lots of pumpkin seed is very good. It's also high in zinc. And, you know, zinc is one of the one of the one of the elements that would help men, that would cause ED, erectile dysfunction as well. So food high in zinc would also help, and one of those pumpkin seeds, very high in zinc and anti-inflammatory as well. So prostate cancer, enlarged cancer, prostatitis, yes, eat a lot of pumpkin seed. That would help you. What to eat? We said pumpkin seeds, nuts such as almond, cashew nuts, peanuts, and pine nuts. They are also high in zinc and anti-inflammatory. Fish, if you do eat fish, so oily fish, fish like salmon and salmon, they are high in omega-3. Or if you can get your omega-3 from plant-based or anywhere else, then you can omit the fish. But you need omega-3, and you mostly find omega-3 in fish, oily fish. And these are high in anti-inflammatory. Vegetables such as tomatoes, broccoli, and kale, they are rich in vitamin C, and vitamin C helps to reduce the chances and development of enlarged prostate. Tofu as well. Tofu have isoflavonoids, and they help with your enlarged prostate, to reduce the prostate. Fruits such as citrus fruits, which is also high in vitamin C as well, will also help. What to eliminate from your diet, what not to eat. Things such as white flour, white rice, white bread, anything white, cheese, milk, ready-made food, refined food, crisp, some cereals as well, homemade, ready-made sauces, sodas, those are the, you know, fizzy drinks, fried food, refined oils, fats, chili peppers, vinegar, chocolate, and nicotine, and alcohol as well. So stay away from red meat. Stay away from eggs and poultries. I'm looking at the time, so I'll just run through. Sugar, sugary food as well. You know, sugar is one of the top things for cancer. Cancer love to feed on sugar. That's the food, one of the food for cancers. Spices, you know, very spicy food. It's not good for you as well. Caffeine, stay away from caffeine. Instead, you could use substitute teas like chamomile tea, bamboo. You can get bamboo, and those caffeine-free drinks from Holland and Barrett. like dandelion root, bamboo, you can substitute your caffeine with those and drink lots of herbal tea, like the stinging nettle tea, chamomile tea as well. Stay away from dairy, such as milk and cheese. You can substitute them with almond milk, with soya milk, with coconut milk. There are lots of choices now, healthy choices on the market, so we shouldn't have a problem with substitution. And alcohol, and I know that Adventists, we don't drink alcohol, but there might be non-Adventists here as well who this would benefit as well, so stay away from alcohol. This diagram shows you ways how you can look after your prostate. You can massage your prostate. So if you stoop down, like if you squat and you put your finger between your anus and your testicle, that's where your prostate is. You can massage it. So you can massage it, a few times a day or once a day, twice a day, maybe in the morning when you wake up and in the night before you go to bed. Massage your prostate, especially if your job is a sitting down job. So massage your prostate, that would help with the lymph node around the prostate as well. Important tips. Early detection can save your life. So men, if you're above 35, if your sons or whoever in your life, any male around you, please advise them to go and have their prostate check early as 35 years and up. If it's in your family as well, have them check as well. So especially for our Black men, put your pride and macho-ness away and have your examination. Being macho is not living in pain and suffering. It is not finding the toilet first wherever you are, whenever you are out. It is not being embarrassed when you have an accident. It is not confined at home, scared to socialize due to embarrassment. It is not dying early and leaving your family, friends, and loved ones with broken hearts and sometimes even financial stress because you are the breadwinner in the home. So put your tabooness aside and your embarrassment, not wanting to have your rectum touched to be examined. Think about your family and your loved one and the pain you would bring to them if you are not detected early. If you see any sign of your urination, you're not urinating as you normally would, please go and check. This can save your life. Okay? So John 3, 3 John 2, beloved, I pray that you may prosper and be in health just as your soul prosper. Thank you for listening.